If you knew that a trillion-dollar industry was making money off of people being sick, do you think that the industry earns that money from curing people or by giving them lifelong prescriptions for medication? A pharmacy is going to make way more money off of selling medications and meds for the side effects of meds. The pattern continues. On the other hand, doctors are not expecting their clients to change their lifestyle habits and to commit time and energy to a regular exercise program. So usually what happens is that they prescribe a pill as a quick fix. It may be more convenient, but it is also more expensive. And where does this money come from? Everybody. We all are taxed, and it goes towards medical expenses. Really, the root of the problem is avoided. The root is often that people are living sedentary lifestyles and are just not moving around. By simply exercising, many of the chronic diseases that Americans face can be prevented, like obesity, diabetes, metabolic syndrome, end-stage renal disease, coronary heart disease, osteoporosis, cerebral palsy, Alzheimer's disease, multiple sclerosis, low back pain, cancer, stroke, depression, asthma, arthritis, and the list goes on. What I'm trying to get at is that we should default to exercise as a primary method to treat these chronic diseases before taking medications or having surgeries done. We can agree to disagree, but a little bit about my background is that I studied exercise science for 5 years, and my favorite courses were in exercise physiology and management of chronic disease. I got my bachelor's last May in kinesiology, and I apply what I know now as an athlete at the Olympic Training Center. So exercise is my life, and exercise gives me life, and an abundant one too. And I believe that everybody can benefit from exercise and physical activity. So I'm a strong believer that everyone, whether male, female, big, small, old, or young, everyone can benefit from taking care of their own bodies. As a nation, we've been hit by unnecessarily high taxes because of medical expenses that could be prevented. I'm going to explain to you how exercise will make a huge improvement in our national medical expenses and our prevalence of chronic disease. Our nation needs less pharmacotherapy and more physical activity. Dr. Marla Walters, a cardiac rehab therapist and professor at the University of Jamestown, agrees that exercise is just as effective as most medications in preventing and treating chronic disease. So my proposition is that having less sick people means less tax dollars unnecessarily spent, and millions of people will enjoy a longer and more fruitful life. From these statistics I have pulled up from my text entitled The Clinical Exercise Physiologist, it says that obesity affects 35% of American adults and costs the nation $146.6 billion a year, according to the National Health Expenditure Accounts. Diabetes affects 26 million people, and the economic expense is $174 billion a year. In 2008, end-stage renal disease was prevalent among 23 million people and cost America $39.5 billion. And those numbers are rising. In 2007, coronary heart disease affected 16.3 million people who had heart attacks, and 1/6 of those have died. That cost America $177.5 billion in medical expenses to help treat them. Alzheimer's affected only 5.3 million people, which is half the size of New York City, but cost us the big bucks at $236 billion in U.S. medical expenses a year. That is a lot of money that we're spending when maybe all we needed to do was prevention tactics and get everybody on an exercise program and save billions of dollars. That's the idea. So, I was looking up through some old college textbooks, and one of them was the American College of Sports Medicine, ACSM, manual. And they describe the benefits of exercise being a decreased heart rate, a decreased blood pressure, decrease in bad cholesterol, which is LDLs, and the ACSM explained that inactivity is a contributor to the risk of heart disease. And I also have a graph from the ACSM that explains the relationship between mortality and activity and fitness. So over on the lower side, on this side, we have the active and fit group, and on the other side, the high side, is the inactive and unfit group. And participants who improved from the unfit group to the fit group had a 44% decrease in mortality. That's almost twice as more likely to survive. And for every minute of increased activity, they have found that an 8% decrease in mortality risk resulted. That's huge. So time matters too. Intensity is also directly related to the decrease in prominence of disease. So where do we begin in the gym? According to the 2008 Guidelines of Exercise Prescription for Improved Health, there are 4 essential components: frequency, intensity, time, and type. Frequency, they recommend that the average American work out for 5 days a week at moderate intensity, or 3 days a week at vigorous intensity. This could be between a walking and jogging pace. And the duration should be 150 minutes a week at moderate intensity or 75 minutes a week at vigorous intensity. So that's about 30 minutes a day at moderate intensity, and that's pretty reasonable. The type would be aerobic, cardio machines, and resistance training, which would be light lifting of weights. So I understand that not everybody can do this plan. There are some exceptions to the plan, and sometimes there's a situation where there is not an alternative to medication and pills. And sometimes pills can coincide with exercise prescription as well. For instance, people who are bedridden or physically impaired may not be able to move by themselves, and that's where we have a drug that allows their heart to race as if it's simulating an exercise bout, or putting stress on the heart only enough to exert the simulation of exercise. And what happens is we give them that drug, and then we'll have somebody else manually move their arms and legs so that their joints are being moved as well, and they retain more of their capabilities that they had before they were bedridden or paralyzed or in a coma. So there are situations. Basically, this is how the spectrum goes. The less physically active we are, the more likely we are to develop a chronic disease. All the diseases that I listed earlier, they share one thing in common, and that is that they all have inactivity as a risk factor. If 33% of Americans are sedentary and 40% of people are diagnosed with chronic disease, there is most likely a correlation between inactivity and being sick, according to the National Health Council. So, in conclusion, we should primarily invest in our health through exercise and avoid taking medications at all costs. Not 100% of the time should the go-to cure be solely a doctor's prescription drug. Medications are often overprescribed. So, knowing this, altogether, we are responsible for our national medical expenses by taking care of our own physical health. That is our job. Exercise, yes, it is underrated, but life is short. Exercise makes it last longer and more abundantly. So let's set the tone for the next generations so that the next generations will reap the benefits of our good and healthy lifestyle habits. So we need to start now. We must live active lives and depend less on pharmaceutical drugs.